technology I'm going to end up with here. Oxygen saturation, extremely important, but you're going to hear about STO2, tissue oxygenation. Pulse oximetry tells you minute by minute saturation of the body, but we had a gentleman come over from Tokyo, and they have tissue oxygenation band on the forehead that tells them second by second whether their meds and their oxygen therapy are curing patients. This is a little device by Think Labs that we had in GEMS that is the new wave for stethoscopes. Hey, the millennials, they like listening with headphones. Guess what? This is 100% more effective than a stethoscope. It's just archaic that we're using something that uses wind to be able to detect things. And this I saw at FDIC a couple years ago, and we used to pay $3,500 to $4,000 for a forward-looking infrared to be able to see body heat and fire inside a wall. This is $300 on Amazon.com. So I can look at somebody and tell whether they have a temperature and a rising infection. I talked about wound management. This is a Z-Medica simulator for packing wounds. And there's the little Innova device down there to tell us whether we're doing it right. See it? You got to get that in the right area or you're not packing the wound properly. This we saw at FDIC. And Rescue Essentials has a simple $250 trainer to be able to show people how to pack a wound. In the state of New Jersey, you're not allowed to pack wounds. But you know what the state says? If you happen to have the gauze go inside, that's okay. Oh, I understand. There's a way around everything. We'll have these as far as simulators in EMS today. We're bringing more rescue to EMS today. In rural areas, the tools are now small enough that I could carry them on an ambulance. And when I get there, I shouldn't have to wait for a $100,000 or a $1 million rescue truck to come to the scene. So we're actually working with the Salt Lake City Fire Department. You guys back there know the guy in charge. Their rescue and USAR guy is brilliant. We're going to have, he can bring me 50 cars into their lot and let people play. We're going to take them up into a wilderness area to teach them how to bring people down mountains. We're going to take them and show them when a trench collapses, how to do proper management inside of a trench. Because EMS people are getting killed because nobody's ever bothered to train them. So we're going to train them. Our active shooter stuff, we're going to involve police and EMS and fire. Okay, ropes, harnesses, devices, belay devices. EMS people get to the scene sometimes 20 minutes in a rural area before somebody else. They have to learn how to slide a rope and go down to get to the patient and secure the car until the rescue crews get there. So we're looking at that. These guys from SNS have this trainer. We can incorporate that over at the Fire Academy so people can extract people from an upside down car and begin to understand it. You guys are just at the FDNY program again. It's huge. It's a really important thing for people to have hands-on training. I simulate. This is massive as well. People don't understand. That's not a $30,000 monitor. That's a couple $100 iPad that fits in with their software and can mimic anything that a monitor can do. So we're going to try and incorporate that into the GEMS games. We have been using it for years just to show capnography readings, but now we're going to expand it potentially to have somebody go to a station and pick up cardiac rhythms, because you can change it on the fly. And you know what? They have to do it just like it's their own monitor. Virtual education, if you've been following USA Today and other things, it's coming. It's here. What device you want to pick, so be it. Even for the distance learning people, you're going to do distance learning, then you're going to give somebody something to put the headset on, and they're going to have to physically go in and clear an airway. They're going to physically go in and suction an airway. That's where the state of the world is coming. We have people now that are having GoFundMe accounts and other things to get them to EMS today. We ask you, the exhibitors, to also buy some extra passes or give us passes that you're not going to use. I think we gave 300 away last year. 117. Okay, I want to give 300 away this year. But you know what? Those are 117 people that you have to hear these people when they come to EMS today. Oh my God, I've never been to a show like this. I could never have come if the exhibitors didn't give me a free pass and somebody paid their way to come. And you know what? They keep coming back every year. How do you exponentially grow your conference? By introducing people to quality education. So distance learning, on-course learning, all these things, extremely important. There is no reason when a crew is bored sitting on a street corner waiting for the next call that they can't get some CE credit. And there's no reason that they can't put their iPhone into a device and be able to take some tests and some skill monitoring online. I talked to you last year about this. This product is a little closer to the market. It's now in many hospitals in the San Diego area. The call button is gone. The patient doesn't have to wait. I'm in pain, I'm in pain, I'm in pain. You know who knows they're in pain? The nurse at a central nurses station gets a blip, bloop. Data algorithm tells them that AJ's blood pressure is beyond what we want it. His pain threshold is beyond what we want it. His respiratory rate's jacked up. And all of a sudden they come, Palomar Medical Center, every intensive care room has this. So the nurse now can monitor 12 to 15 patients. No, the machine monitors 12 to 15 patients. And all they see on their thing, that's the visual of what it looks like. But what the patient sees is a little telephone. And if they need help, they push it, and the nurse talks to them. Why am I showing you this? Because this is data, as it should be, algorithmic data that's going to go to community paramedicine. One community paramedic will be able to monitor 30 patients in their community, and when something goes wrong, that same screen that the nurse sees is going to be in a community paramedic's vehicle. That's what I see, and we already got people like Matt Zavatsky that are willing to field test it. And so I can tell you every parameter. I can tell you whether they're sitting, standing, breathing, have a temperature. They don't have to tell me anything, and I don't have to physically be at their side. And I called the patient to find out what was wrong with their high temperature. Septic shock? Guess what? Somebody goes home after an operation, high predictability for a return with an infection. If they have an infection, they're not even going to know it. Christ, you call grandma now and you say, how you doing, grandma? Oh, I'm still not feeling well. Have you taken your meds today? I think so. You think she knows she has a fever? I'm always hot. You know, we're going to tell exactly what her temperature is, and we're going to respond to that temperature rate. Companies like ESO and ImageTrend offer these kind of things now. These are the people that are going to survive in the data industry because they're thinking ahead. And at the leadership forum that I was at last week, people were very vocal to the data people saying, you know what you people have to do? You have to integrate your data. You hear that every day. My hospital uses this version, this hospital uses that version. I need to exchange data. In New Jersey, every ALS patient is required to be followed up. The ALS system must find out what the discharge diagnosis of that patient was. You know how they're doing it? Manually. They have 3 staff members in Jersey City that they could eliminate $100,000 worth of expenses if somebody would give them a secure data link that I could beam in and say, I took Chad in Tuesday, how'd he do? And it comes back to me. That's coming. These companies know it. They're under the gun. They're doing it. They're doing community paramedicine. They're doing all these things. And the little data companies, they're going to go away because they can't compete with this. So everything's going to be data-driven. Things like Massimo and their oxygen saturation, nobody even knew what CO poisoning was years ago, and now it's a household name.